最前沿的科学研究
Science
Innovation und Wissenschaft.
Madage de technologia
كشف جديد
Știință.
经典步上
Pesquisa
Discovery. Rehashing science.
Robots. When I hear this word, I imagine some wiry network, hard human-sized machines like the Spot Mini robots who can jump, crawl, talk, swim, or even carry out complex tasks in outer space. But when it comes to the human body, is it possible to design robots to navigate the human anatomy? Yes, in fact, you can.
The robot we are talking about today could potentially be used to deliver clot-reducing therapies against stroke or other brain blockages, or they could potentially be remotely operated by surgeons in a minimally invasive procedure for previously inaccessible lesions in the human brain.
But to tie this imagination with reality, we need untethered, flexible, sub-millimeter scale robots that are able to pass throughout narrow, delicate, intertwined cerebral vessels. They also have to be biocompatible with adaptability, precise directional steering, and navigating capabilities. This was made possible by an MIT group led by Dr. Xuanhe Zhao, who created a magnetic soft continuum robot very much like a thread. This research was published in Science Robotics in August this year.
And today on Science Rehashed, we are going to hear all about it from Dr. Zhao himself. Dr. Zhao is an associate professor in the Department of Mechanical Engineering at MIT. He holds expertise in solid mechanics, soft material technology, 3D printing, just to name a few, and has published over 100 papers.
Thank you for joining us today, Dr. Zhao. Tell us a little bit about your background and how you got to where you are now.
I got my bachelor degree in electrical engineering, and then my master degree in material engineering, then PhD degree in mechanical engineering, and a postdoc training in biomedical engineering. During my PhD and postdoc training, I work with soft materials, but study their fundamental properties. For example, how they respond under electric field, how hydrogels swell. And for postdoc training, I actually worked with Professor David Mooney. In his lab, I understand more disease-driven research. Once I established my own lab, initially it's still studying fundamentals of soft materials. But as the project evolved, we focus more and more on societal impacts of the materials that we developed. That's how eventually we come to this project.
You and your team really focus on solving biological concerns by combining knowledge on mechanics, robotics, and material science. And this interdisciplinary nature is very exciting, but also very challenging. Can you please tell us about your motivation to apply your engineering expertise in the field of health?
My group is focused on the interface between humans and machines. We are advancing the science and technology on this interface. The opportunity that we see on this interface, there are twofold. On one hand, we see a great progress in terms of understanding and engineering human body, such as biology, genetics, modern medicine. On the other hand, we see a similar progress in terms of the design and development of machines. However, we see a huge gap in between, and we see great opportunities on this interface. This gap between humans and the machines can be further filled with new technology. One application on this interface obviously is in biomedical application. We harness the most advanced technology developed in the domain of machines, apply them to human body to achieve better health of society.
What are the limitations of the medical robots right now?
In general, the limitation is actually the fundamental contradictory properties of a human body and machines. Human body, right, except teeth, bones, and nails, is made of soft tissues. So they are hydrogels, polymer network infiltrated with water. So it's soft, it's wet, it's living. On the other hand, common machines, they are made of rigid, hard, dry, non-living materials. So these fundamentally contradictory properties cause this dramatic limitation. More specifically, in terms of our robots, the limitation is really existing medical robots using the approach of minimal invasive operation. If you look at the operation end, it's still quite a rigid tools. On the other hand, we have some this endovasculature surgery devices, such as the manually controlled guide wire. The tip is made of soft materials, such as elastomers. However, the surgeons need to manually twist this guide wire to navigate it inside the blood vessel. Then the surgeon need to work very close to the patient. At the same time, the patient is under X-ray scanning for imaging. Then the surgeon actually receive lots of radiation. Another limitation is in a big city like Boston, we have enough surgeons to operate these time-sensitive patients, such as stroke patients. However, in rural area, we just intrinsically do not have enough surgeons. And if you transport those patients to a major hospital in a large city like Boston, then the golden hour for the treatment of a stroke, for example, may already pass.
Just to define this, the golden hour, you're trying to remove the clots within the first 90 minutes after the stroke.
Yeah, the golden hour we refer to, especially for this ischemia stroke, is really the 90 minutes after the occurrence of a stroke. If a patient can be treated, then this stroke may be even reversible. So, you can even fully recover from the stroke. However, once you pass this 90 minutes, if a few hours after the stroke, then the permanent damage to the brain already fall.
And we know that stroke is the number 5 cause of death in the United States. And if we can treat the acute stroke within the first 90 minutes, that can increase the survival rates significantly.
Currently, every 30 seconds, there is one patient suffered from a stroke in US. So that's number 1 cause of long-term disability in US. And in China, that's the number 1 cause of both death and long-term disability. And a majority of stroke patients actually cannot receive timely treatment due to the unavailability of doctors around them.
Your hope was with the paper that just published in the Science Robotics to design a device that can reverse the blood clots in the vasculature of the brain within the 90 minutes.
The development, we call it a thread robot, we invented. The goal for this robot is really to empower doctors so that they can operate on patients remotely in another room, even in another city. 2 motivations for this robot. Number 1, for rural area to purchase this kind of equipment instead of hire very expensive neurosurgeons to treat stroke patients. Number 2, even for existing neurosurgeons, they don't need to work directly under this X-ray radiation so that at least they can work in another room. Then it's really how to control guide wire, very thin robot, like a thread, how to guide its navigation and the steering.
What is a thread robot?
So the thread robot is thin, soft fiber composed of polymer matrix with magnetic particles embedded inside. And then you magnetize this thread robot. When you apply a magnetic field from outside, you can bend this robot in the way that you want. Then you can really guide inside blood vessel system. So the diameter of this guide wire is on the order of 100 to 500 microns. So it's very thin. The tip of our guide wire is a straight. It's now J-shaped. This is a straight guide wire at a place to find a branch of the blood vessel to navigate to. We apply an external magnetic field to bend this guide wire. Then smoothly you can navigate this guide wire inside the blood vessels. All this can be done under the control of applied magnetic field. We do not need a surgeon to twist this guide wire from outside.
And how do you prevent the thread robot from piercing through the blood vessel?
if you want a robot to navigate in very delicate blood vessels, you really want to make sure it will treat the lesion area instead of cause damage to the blood vessel. Conventional guide wire is this J-shaped guide wire. In many situations, the tip of the guide wire is dragging on the blood vessel in order to guide it throughout the blood vessel. That actually there is a possibility cause rupture of the blood vessel. Our guide wire, the tip is straight, and we apply external magnetic field. In most of the case, we make sure the tip of the guide wire is far away from the wall of the blood vessel during this navigation. That's number one. Number two, we carefully control the advancing of the guide wire, again, to prevent it pierce on the blood vessel or even get in contact with the blood vessel.
To prevent friction with the blood vessels.
Yeah. So number two is contact. Number three, we actually designed a hydrogel coating for this guide wire so that to reduce the friction coefficient of this guide wire 10 times, then you have a very slippery thread inside the blood vessel to reduce the friction. So a combination of these 3 points, we showed this really very smooth navigation of this guide wire inside this real size mock blood vessels of the brain. It's made from a CT scanning of patients, the real architecture of the blood vessels, even aneurysm of the patients, and then we can smoothly navigate inside those blood vessels without piercing or without significant friction.
So when you design the magnetic field, you have to figure out initially how much of it to apply. And throughout the body, there's thick vessels and thinner vessels lined with different types of tissue. And so how do you kind of model that before you start the procedure?
The reason we choose to use magnetic field to control the robot is that human body actually is transparent to magnetic field. Right? We do MRI, we do this kind of a magnetic field-based diagnosis. Magnetic field is unshielded by human body, unlike an electric field. Secondly, this level of a static magnetic field is very safe to human body. It's on the order of 100 millitesla. So it's very safe to human body. Independent of the thickness or the configuration of the blood vessel, we apply the same type of field strength. It's only how you change the direction of this field, then you can control the bending of this guide wire inside the blood vessel to navigate to the branch of blood vessel that you want.
Fascinating. I'm coming back to where you mentioned how you could prevent friction with the blood vessels. How you manage the blood viscosity?
In the experiment, we used simulated blood with a similar level of viscosity as a real blood to simulate the environment inside the blood vessel. And we actually observe the friction between the guide wire and the blood is much lower than the friction between the guide wire and the blood vessel, which is also the case in existing guide wires. So then we focus a reduction of the friction between the guide wire and the blood vessel instead of the friction between guide wire and simulated blood.
One point is how you test the robots and how you can model the blood vasculatures in the human brains.
In the current study, we mainly test the navigation. So we want to drive this thread robot across very complicated patterns or structures of the blood vessel in the brain.
Yeah. This is not a real brain.
This is not real brain. We haven't done animal test yet. So if we want to discuss a future study, the direct next step is to add functionality into this thread robot. Actually, we did that in the paper as well. For example, we can add optical fiber as the functional core of this robot. Then once you achieve a certain lesion area of the blood vessel, you can deliver laser to there for potential treatment. In future study, we will also try to deliver drugs, even deliver catheters to those places for different types of treatment.
So based on my understanding, the robotic thread can be multifunctionalized, meaning that features can be added. For example, you can have a synergistic effect of delivering clot-reducing drugs or break up blockage with a specific drugs.
Exactly. So to clean the clot is the major goal. However, at the same time, this system is really multifunctional. For example, we already demonstrate we can deliver laser while a functional core of an optical fiber to specific location of the blood vessel. We are very confident we can deliver drugs, even deliver this kind of coils for embolization of aneurysm. So these will be future tasks.
You believe that this will make the system more complicated? We're going to the point that where you need a very expert surgeon to deliver a specific dose of drugs or a specific laser to remove the clot.
Currently, the need for the surgeon in the surgery room is to twist this delicate guide wire. Is really for the navigation. So that's technology plus art. For the treatment part, that can be standardized. So as long as you can navigate to the side, I believe the need for surgeon for those operations can really be remotely operated.
Currently, stroke patients need to be moved to the very advanced hospital to be treated. So this will give us hope that in the near future, hopefully, they can be treated in very remote areas.
Yes. Our vision is this. Eventually, this system will be something similar to intuitive surgery. Instead of using this rigid arms, it will be thread-like robot, especially for endovascular treatment. Then for the surgeons, especially under this broadband communication, can operate it in a remote city. Then in rural area, you may have this kind of treatment center with a surgeon in another city to remotely operate. The key is to make this task very simple and straightforward, enabling remote operation. We even hope many of this process can be automated. The comparison I would like to make is, autonomous car on the street, right? So,
any AI will be involved?
Yes. So we are developing this AI technology to navigate cars on the street. However, on the street there are lots of complicated events, right? On the other hand, in the blood vessel of patient, we can do a fluoroscope or CT scanning to get a very clear roadmap of the blood vessel before the surgery. This kind of emergent event will be much fewer than something on the street. Right? The situation for the blood vessel may be even simpler than the situation for autonomous drive. With the development of AI technology, we may be able to leverage technology from the domain of machines to apply that to the domain of human. We are not replacing surgeons. I need to emphasize that. We need a surgeon. We are empowering surgeons so that one surgeon can help many patients in the similar time and even remotely. There is an obvious societal impact. Everyone in this game is really trying to push this forward. On one hand, this is extremely challenging. On the other hand, I'm very hopeful for the success.
And besides the advanced technology that the robots hold for clearing the clots, it's a minimally invasive surgery. To the best of my knowledge, the mini robots will be inserted through the leg or the groins of the patients, and then will be navigated through the brain vasculature.
Yes, exactly. So this will be minimal invasive incision. Currently, it's inserted through the leg because the path is simpler, but a more desirable path is through the arm. Really, because it's shorter, so you have less friction, but the navigation is more complicated. However, for the thread robot we developed, such level of complexity for navigation is really simple. So that in future we may even enable shorter distance of operation under this minimal invasive operation. This technology may open many new avenues, not only for treatment of a stroke, but many endovascular or intervascular operation.
Just want to go back and ask a little more about the details of the robot.
In terms of diameter, it's on the order of 100 to 500 micrometer. In terms of length, the robot can be quite long. It's like the existing guide wires, but the tip of this robot is on the order of a few centimeter, which is a magnetic active. Then you can apply magnetic field to bend it, to navigate to the branch of the blood vessel that.
And in comparison to the J-shaped guide wires? Is it smaller or
in terms of diameter, they can be the same. We can make it smaller, but currently we didn't see a need. So the key difference is the tip is straight. You really do not touch blood vessels.
So I would like to touch base on a point that you mentioned before about mapping the vasculature. Just looking ahead in the future, are we creating another vasculature map like a genome atlas?
The answer probably is no. For different patients, they have, especially in details, very different structures. But such imaging can be quick. So one challenge for developing this robotic system is really how to integrate the imaging system with external control so that you can control this robot.
And are you planning to test the system with any animal studies or human clinical trials?
Yes, we are currently further improving the technology. We plan to test it in a porcelain model. So instead of patient directly, hopefully in a couple of years. After that, we may translate the technology towards clinical test in patients.
And the focus will be stroke patients.
Current focus will be stroke because that's really time sensitive. Stroke is more straightforward to treat.
And if you would like to be very optimistic, how long do you think the technology will take to translate from the bench to the bedside?
Probably 10 to 15 years. Maybe faster, but I do not want to be too ambitious in terms of the time scale. By the way, let me emphasize, there are already FDA-approved devices or robots. It's just that they are too large to navigate inside the blood vessel of the brain.
This should accelerate the process of the FDA approval, hopefully in the future.
We believe since there are already precedent there and already successful cases there, we hope this will help this translation process.
About the biocompatibility of the skin of the robots, which is a hydrogel. Could you please comment on that?
Biocompatibility is very important. This is not a long-term duration of the device in the body. Currently, for the hydrogel skin, actually, we use materials that has been used in FDA-approved applications, and we did an in vitro test of the biocompatibility of that hydrogel coating.
So the biocompatibility is a very generic name these days, and everybody's using it in different papers, and it looks like an umbrella term. Everybody says is biocompatibility. However, we know for certain that biocompatibility need to be checked with the specific tissues, with the specific organs, with the specific cell types. How are you planning to...
Biocompatibility need to be checked for specific application. A material or a device is biocompatible for this application. Before we do even animal test, we will do systematic biocompatible check. But again, this is a short term. We are confident that this will be biocompatible for this application.
We talked a lot about the application of your technology in medicine and surgery. Have you thought about applying it in other basic sciences?
This technology can be applied to any operations in an enclosed space. So in that sense, there may be other potential applications, but we have not explored that. I think biomedical or this application on the interface between humans and the machines probably will be the major application of this technology.
We talked about using an external magnetic field on the outside to guide these wires. So I'm imagining an operating room, and there's a lot of different other equipments that are magnetic, potentially. Would you imagine that using your device would require a special room kind of designed for your particular equipment so that it doesn't interfere with the magnetic field?
This is one potential limitation of this technology. In this endovascular operation, right, possibly we don't need many other equipments or devices inside that room. Again, there are already existing equipment to apply such a magnetic field. Or they already designed such an environment for this heart surgery that you can operate this device with the patient in it and do not interfere with other operations such as imaging or other operations.
And then the magnetic field, how does that look?
Existing one, a few options. Use a pair of permanent magnets to rotate coupled with imaging system. Even simpler one, just use a robotic arm grabbing one magnet, apply this field, even it's non-uniform, but you can still easily control the guide wire. Again, this is already a relatively mature technology.
I would like to touch base on the stroke patients. When the patient has the stroke and need to be transferred to the hospital and then be diagnosed with the stroke within that golden hour, within the 90 minutes, do you imagine a time the technology would be available at home?
At home, I don't know. But in an equipped ambulance, I can imagine it's possible. Instead of have medical centers with this equipment, you may have this ambulance, hopefully, that can do the treatment. I didn't see any roadblock for this to become true.
And hopefully, if it's not going to be true in a CPR fashion, hopefully it will be in all outpatients clinics. Thank you very much for a very fascinating discussion on this technology.
Delighted.
Thank you for listening to our episode today.
And we have more exciting scientific discussions coming up soon. Stay tuned on Science Rehash Podcast. Please review us on iTunes and Spotify and follow us on Instagram, Twitter, or Facebook.